So my patient and I were just having a conversation around her diet because she actually has been vegan for about 8 years, and she has quite a lot of gut health dysfunction at the moment. She's had small intestinal bacterial overgrowth, SIBO, which we've treated, but it seems to have come back. She finds when she travels, she tends to get a lot of gut issues as well, and also her iron is quite low. We tend to do an iron infusion a couple of times a year. So we were talking about bringing in more meat products because somebody else had mentioned that to her. And we were talking about what feels ethically right for her, because obviously she cares about the environment and animal welfare, and these things are also important. But however, it seems like perhaps her nutrition could be having a negative impact on the way she feels. So the first thing I said to her is that we always have to look at what feels comfortable for her and not just give blanket advice. And I was saying even something like bone broth, which is so full of collagen and it can help reduce inflammation in the gut, could be a good start. Maybe just once or twice a week, bringing that in and seeing how that feels for her. We're also talking about ethical meat. So some people find venison feels more ethical for them because, the animal has lived a good life, has been in the wild, it was being culled anyway. So for them, that feels more ethical. And then we were also talking about, ordering, really good quality meat. And then we were talking about what our ancestors would have done. Obviously, my ancestors may be different to your ancestors in terms of where we grew up in the world. But basically, people wouldn't have been eating meat every single day, and people wouldn't have been having processed meat or processed food, really. And when an animal was consumed, the whole animal was consumed, not just, a little chicken breast or something. So, what I was saying is, she doesn't necessarily need to eat meat every single day. And I certainly wouldn't recommend that for someone who hasn't had meat for as long as my patient hasn't. But I said, maybe introduce some good quality meat, even starting once a fortnight, and see how that feels in her system and her body, see how that affects her gut health and her symptoms, and if it has an impact on her energy and her mood and her get up and go. And then perhaps she could look at maybe doing it once a week. Now, I've read a lot of studies on plant-based diets. And of course, to a degree, a mainly plant-based diet is of benefit to the majority of people. But perhaps having meat once or twice a week can be of benefit for protein, for iron, for energy, and for regulating gut health. So she said these are things she's going to think about. And, of course, I'm not going to force anyone to do anything they don't feel comfortable with. I've got vegan patients, and quite often when people become vegan, they can feel really good because they've cut out loads of the rubbish in their diet. So, the excess, dairy, the processed foods that have the dairy in them and things like that. So they feel so much better. But then after a while, not everyone does feel better. So it is also about looking like, what's good for the planet, what's good for animal welfare, but what's also good for my health. And surely we can find a balance and some middle ground there. So that's just my approach. Again, I'm not wanting to tell anyone you have to eat a certain way, but I think it's about listening to your body, the signs you're getting. If your diet is causing you to maybe have some gut issues, and of course a processed diet can cause you to have gut issues, or a very sort of what we'd call sort of standard Western diet can cause these problems too. So it's all about looking at things in context and then adjusting accordingly. So I hope that's helpful, and have a great day.